Greetings, Sanbanani Absheni. Welcome to my YouTube channel. Now, in today's video, we will be diving into part 2 of understanding pre-eclampsia. Last week, we spoke about the pathophysiology of pre-eclampsia and the etiology. And so this week, as I said, we'll be diving into looking at different systems and how pre-eclampsia affects the system. Now, this is important because once you understand what system is damaged, what is happening within that system, then you will recall the signs and symptoms. It will be easier for you to understand why women with pre-eclampsia will have your puffy face, will have your swollen lower limbs, and why women with pre-eclampsia will have dizziness, will complain of headaches. And now we are gonna dive into that. I hope you enjoyed today's episode. Let's get right into it. So firstly, let us start with the hematological system. The hematological system consists of the blood, bone marrow, and other organs that are involved in the transportation of blood throughout our body. So remember that, as I said, with pre-eclampsia, we find that the endothelium cells of the blood vessels become damaged. Now, the endothelium cells, because they're responsible of what they permit in the blood vessels, the permeability, how fluids flow in and out of the blood vessels and to the cells. Now, because they are damaged, there will be a leakage in the blood vessels. So fluid will actually move from the intracellular space into the extracellular space. So now, because of this leakage, this is why we'll see that women with preeclampsia will have edema of the lower legs, will have a puffy face, will have swelling, generalized swelling, and this puts them at risk of hypovolemia because they are losing a lot of fluid within the intracellular space. Number 2, let us get into the pulmonary system. So now the pulmonary system will suffer in a sense that because now there is a change in the permeability and how fluids move throughout the body, there will be a move of fluid within the lungs. So the fancy name to term it is pulmonary edema. There will be pulmonary edema. This woman will be at risk of decreased oxygenation, cyanosis, and etc. because of the fluid that is within the pulmonary space. Number 3, the coagulatory system. Now, this is a very important system because it assists us when we get hurt or when there is a damage within our body. And so because of the damage within the endothelial cells, which is the lining of the blood vessels, the coagulation cascade will be activated. Now, the coagulation cascade tries to come to the rescue by repairing the damaged areas. But now, because of this, there is a use of a lot of platelets because platelets are released in order to aid to the areas that are damaged. But now, because of this puts the woman at risk of thrombocytopenia, where there is a decreased level of platelets within the body, the risk of DIC, and the risk of hypoxia. Remember that when these platelets are activated, they accumulate in one area and they can actually cause hypoxia. And also with DIC, it puts them at risk of bleeding, right? Number 4, the renal system. Remember that the renal system also has a specific blood supply that makes sure that there is oxygenated blood that comes to the renal system. And now, the glomerulus capsules play an important role into making sure that what is supposed to be filtered as urine becomes filtered, and what's not supposed to get filtered is not filtered. So now, since there is generalized hypertension throughout the body, there will be a vasospasm to the afferent arterioles, which are connected to the renal arteries. The afferent arterioles bring blood supply or the fluid that needs to be filtered towards the glomerulus capsule. The glomerulus capsule is very picky into what it filters. So protein, which is in form of albumin, is normally not filtered into the urine. But because of the damage that occurs because of the generalized hypertension throughout the body, the glomerulus capsules become damaged, and then they start to filter even the protein that is not supposed to be filtered. That's why we'll also see an increase in creatinine, increase in uric acid, and also oliguria. Number 5, the hepatic system. The hepatic system consists of the liver. The liver has a huge function throughout our body. It is involved in the metabolism and the removal of toxins throughout our body. Now, because of the hypertension that occurs throughout our body, there will be a vasoconstriction of the hepatic vascular bed, which will cause hypoxia and edema of the liver cells. Now, because of this, the woman will complain of epigastric pain, which is because of the swelling that will be occurring. There will be an altered liver functions, which means there will be a decrease in albumin and elevated liver enzymes. Now, let us talk about the central nervous system. So because of the endothelium dysfunction and the hypertension that is occurring throughout the body, there will be an increased permeability of the blood-brain barrier. Now, this will manifest itself as the patient complaining of headaches, visual disturbance, and convulsions. Now, remember that the increased permeability in the blood-brain barrier occurs because of the response that the brain will have with the hypertension that is occurring and the damaged endothelium cells. It is also important to note that if the woman complains of such signs and symptoms, we must put into place preventative measures, because it means now she is going into the phase of having severe pre-eclampsia. And we know with severe pre-eclampsia, it can easily lead to eclampsia itself. And so we don't want eclampsia to occur. Hence why in my next video, I'll be explaining the preventative measures to put into place so that the woman does not get into the stage of eclampsia. The early management of pre-eclampsia, what we can do is we can give the woman calcium supplements. Calcium supplements will help to lower the blood pressure. And then we can also give a low dose of aspirin, that is 75 milligrams. The woman can take it daily from 12 weeks of pregnancy. We can also encourage the woman to regularly visit or have her antenatal visits so that her blood pressure can be monitored. And if it is elevated, she can easily be managed. Remember that pre-eclampsia is often managed at regional hospitals or your tertiary institutions. Thank you for watching the video. Do share, do like, do subscribe, and do leave a comment of how the video was or any add-ons if you do have them. See you on the next video.